In a CNN exclusive interview, a Texas trauma unit doctor opens up about the impact that not one but two mass shootings in less than 5 years had. CNN's Lucy Kafanov spoke to the doctor at San Antonio University Hospital, where several victims of the latest shooting were taken, the same place where victims of the 2017 Sutherland Springs church shooting were taken. Yesterday, I took this picture right here at this memorial. It's a teddy bear with a message from Sutherland Springs. Lucy, it is unimaginable the first time. The second time for doctors?
The team that I spoke to there described this sickening sense of deja vu, and I can't help but think about these concentric circles of trauma that take place after a mass shooting like this, not just for the community and the families of the loved ones who lost loved ones, but also for these unsung heroes, the first responders, the nurses, the doctors. They're responsible for keeping the survivors alive. We spent time at the trauma unit at San Antonio's University Health Hospital. They are caring for a number of the victims. They're obviously trained to deal with something like this. They know how to compartmentalize, but as human beings, as parents themselves, it's taking a toll. And like you said, it's not their first mass shooting. Let's watch.
Get the glide scope in there, please.
At San Antonio's University Health Hospital.
All of us would be in a level 1 alpha if one came in. Anesthesia's on their way, blood bank is on their way.
Doctors and nurses prepare to receive the most critically wounded. It's one of the busiest trauma centers in the nation.
You have yours laid?
Yep, I got a 21 and a 15 up.
Okay, perfect.
And CNN got exclusive access inside as Pediatric Trauma Medical Center Director Dr. Lillian Liao and her team demonstrated preparations for a mass casualty event.
Anesthesia's here. Go ahead and get up there with Kelly so we can back her up in case it becomes a difficult airway.
Today, it's a drill.
This is one of the teams that we formed. And the day of the mass casualty event, we formed multiple teams such as this.
But it wasn't a drill on Tuesday when a teenage gunman burst inside Robb Elementary School in Uvalde, Texas, murdering 19 children and 2 teachers, injuring at least 17 others, officials say.
It's devastating. I think the same thing that every other person in this country is thinking, how horrible their last moments were, right? And what that scene looks like.
The trauma unit prepared to receive dozens of Uvalde's wounded.
The blood. The blood's been checked.
Nurse Colleen Davis recalled the agonizing wait for patients and a grim realization.
After a while, you start realizing more aren't coming, and you start realizing why, and then the weight of that just kind of sets in, and it stays with you for the rest of the day and all the days after.
4 of the victims were brought right here to University Hospital, 3 little girls and the shooter's grandmother. For the doctors and nurses working here, it unfortunately wasn't their first mass shooting.
Less than 5 years ago, a gunman slaughtered 26 people at the First Baptist Church in Sutherland Springs, just 34 miles southeast of downtown San Antonio. Dr. Liao was on duty.
None of us anticipated that we would be involved in yet another mass casualty event. It's not something we imagined.
Trauma nurse Crystal Flores was working alongside Dr. Liao in 2017 as patients wounded in the church massacre began to flood in. She can't believe it's happened again.
I immediately got this horrible feeling in the pit of my stomach and deja vu, basically because it was even in the same location where we got notified from Sutherland Springs.
Flores is haunted by the lives her team couldn't save.
Just keep replaying things in my brain and thinking what if they would have gotten here 30 minutes after the first notification? We probably would have saved a lot of people, but it's just what ifs, and it just doesn't change the outcome.
Like many of her trauma center colleagues, Flores is also a parent.
He just turned 6 and he's in kindergarten. And today's his last day of school, and I have a 1-year-old. It's just hard, and it's just, how do you tell them?
Dr. Liao says she copes by focusing on the good, her team, her family, and her little ones.
That's what you want to amplify at a time like this, is amplify the being grateful and the kindness that the world shows rather than focusing on the negative, because that can really put you in a wrong place moving forward.
She breaks down when talking about the invisible scars the surviving children will carry.
You know, I kind of thought back to when I was 10 years old, and so when I was 10 years old, my family immigrated to this country, and my biggest challenge was learning to speak English. And you just can't imagine what these children are going through. And it's really unfair. It's really unfair.
And when you walk into that hospital, there's this huge banner that was sent to them by the doctors in Aurora, Colorado. The banner was sent after the Sutherland Springs shooting. The doctors in Aurora obviously experienced their own shooting in 2012. The spokeswoman at the hospital broke down, describing not knowing how many more of these banners she was going to have to make. I mean, these doctors, these trauma unit doctors, are part of a club of their own, a club that nobody wants to be a part of.
What an incredibly powerful piece, Lucy. Thank you. Really special people who do those jobs. And one of the doctors there talked about the invisible scars of the children who survived. We're going to talk about that coming up. Stay with us.